Singapore's Vaccinated Travel Lane scheme has detected only one COVID-19 case from over 900 travellers who have arrived so far. Self-test kits have been flying off the shelves and they are now out of stock at many retailers. The people behind a marketing stunt involving clowns have said sorry for the panic they've caused. It's 5:30 p.m. here in Singapore and you're watching The Big Story. I'm Haryanto Diman coming to you live in the Straits Times newsroom, but with a new backdrop. Subscribe to us so you never miss a single episode. Singapore is actively working on expanding the Vaccinated Travel Lane scheme, which launched on September 8th. According to Transport Minister S. Iswaran, after Germany and Brunei, fully vaccinated travellers from more countries are likely to be able to enter Singapore without having to quarantine in the coming weeks and months.
So, as you know, we now have 2,500 who have applied to travel on the VTL, and up to now, more than 900 have already travelled to Singapore. And they have all complied with the protocols. So that is a very good sign, because it means that people understand what is required, and both on the side of the traveller but also on the part of the other parties involved, they all have basically operationalized the key requirements. You asked specifically, have there been any cases? We have had one case that was detected positive, C+. That was on arrival, and then that case was isolated and is basically in quarantine. So what it basically tells us is the system is working, and we are gaining confidence with it. And I think that's an important prerequisite before we think about scaling it to other countries and so on.
In a reminder that the aviation sector is still struggling, Changi Airport is operating at just 3% of the levels before the pandemic, while Singapore Airlines is at 4%. Mr. Iswaran said that it may take some time for global air travel to normalise, but Singapore will do its utmost to make sure Changi and SIA soar again. COVID-19 self-test kits have sold out at many locations island-wide, with retailers telling the Straits Times that they are working to bring in more stock as soon as possible. This comes as more people are testing themselves before they go to work or to attend events. As Singapore's Director of Medical Services Associate Professor Kenneth Mark explained on Friday, if you test positive for COVID-19 using an antigen rapid test but are asymptomatic, you should self-isolate at home for 72 hours. During that time, if you are concerned, you may want to visit what's known as swab and send home clinic. If unwell, you should visit a GP as soon as possible. And at the end of the self-isolation, you are encouraged to do another ART test. Let's pose more questions about this to Dr. Tan Teck Jack, CEO of Northeast Medical Group. Welcome to the show, Doctor. Doctor, aside from requirements like going to the office or attending events, under what conditions does a person administer a self-test, and how frequent should that be done?
I think as a responsible individual, in such a time, I think all of us should be administering tests to ourselves if we suspect that we have been exposed to an individual who has got COVID-19, or you are close contact, or if you are in a situation where you feel like you could be endangering other people. I think for the frequency of tests, it really depends on your perception of the risk. And right now, people who are in contact with other people who have had COVID-19, then they would be encouraged to isolate themselves and, of course, administer tests immediately and then 72 hours later. And while isolation, please keep away from other people, including your own family members. So this is, I think, the guidelines that have already been set up.
Doctor, another scenario. Now, my co-presenter, Olivia Quay, has sinusitis. How often should people like her do the ART? Is it every time they get a runny nose, for example?
That's going to be very tough, right? So it is difficult to tell whether you have allergy symptoms that result in running nose, or you could be having some sort of upper respiratory infection. So my advice to my patients usually is that they should be testing themselves if they feel unwell. And then for people with allergic rhinitis, please take your medication or see a doctor to sort it out if you're unsure. I think if in doubt, I think that check it out. That is what my advice to my patients.
Right, so it's erring on the side of caution, yeah, doctor. Now, doctor,
right,
there are several care routes, self-isolation for 72 hours, like you mentioned earlier on, and home recovery being two of them. Doctor, help us understand what are the differences between them, given that both require a person to stay at home and have no contact with anyone else?
I think that self-isolation is a responsible thing to do. And Ministry of Health, of course, have given out free test kits for people to stay at home and check themselves in case they are worried about contracting COVID-19, that they have already got in contact with someone. And if those who do not yet have a positive test and they want to isolate themselves, please go ahead. I think that's the responsible thing to do. But those who already have got close contact, and if they have tested positive, I think the preference is to visit a family physician in a PHPC clinic and get it tested for sure. Because the test kits are about 80% accurate. And of course, there's a confirmatory test, which is the PCR test that can be done at these clinics. And that will give you peace of mind, right? And gives you that 100% or close to 100% chance of not missing an infection. So that would be the responsible thing to do. And for those who cannot or unable to leave their home, or they just want to do their self-test, then they should be doing it for 72 hours later once they have got a positive test. Now, if the tests are indeterminate, that means they are not sure whether it's yes or no, they're still very much strongly encouraged to visit a PHPC clinic to see your family physician.
Thanks for your advice, Dr. Tan, and for taking time off to speak with me. I've been speaking with Dr. Tan Teck Jack, who's CEO of Northeast Medical Group. On Thursday, a new category of community care facilities will open, with the first at the NTUC Health Nursing Home in Tampines. These places are for COVID-19 patients who are stable and mildly symptomatic, but have underlying illnesses that require closer monitoring, like chronic cardiac, neurological or respiratory conditions. Several standard community care facilities, like the one at Connect at Changi, will also have some beds stepped up. As Singapore crosses the 1,000 mark of daily COVID-19 cases for the second day in a row, last night the Health Ministry also reported 2 new clusters at nursing homes. Woodlands Care Home has a total of 12 cases, including 11 residents, while Windsor Convalescent Home in Pasir Panjang has 10 cases, with 9 of them being residents. A new cluster also surfaced in My Little Campus in Yishun. 2 new cases were added to the cluster at Toa Payoh Lorong 8 Market and Food Centre, which now has 41 cases comprising 24 staff members and 17 household contacts. MOH said these 4 new clusters are among 16 that are being closely monitored. And as at yesterday, out of the over 870 patients warded in hospital, 118 are cases of serious illness needing oxygen supplementation. Another 21 are in ICU, with most 70 years old and above. MOH said today that overall hospital capacity utilization is getting tighter, leading to some patients requiring admission waiting longer for beds at several hospitals. Most emergency departments are seeing more cases in the past week compared with the previous month's average. And with the number of COVID-19 cases also rising, more beds being diverted to manage them. In other local headlines, a marketing stunt gone wrong. Speech Academy Asia, the enrichment center responsible for clowns showing up in Marine Parade, has apologized for the panic they've caused, and they had stopped the promotion efforts. It's in light of these photos circulating online of a man dressed as a clown outside a school. Police said they received multiple reports of people dressed as clowns and approaching children at various primary schools. Now, the incident also caught the attention of Marine Parade GRC MP and Speaker of Parliament Tan Chuan-jin, who called for a stop to what he said is, quote, some viral marketing nonsense, adding it's not amusing and just plain dangerous. Following the death of former national footballer Muhammad Noor Hussein this morning, the Football Association of Singapore has posted a tribute on Facebook, recalling how the 67-year-old was a member of the 1977 Malaysia Cup winning side known for his dribbling prowess and body feints. Mat Noor's ex-wife, local singer Rahimah Rahim, wrote that he has returned to God and, quote, may he be placed among the righteous. Looking overseas, Hong Kong's first public ballot since China overhauled the city's electoral system was hit by complaints of counting delay, with officials taking more than 10 hours to tally some 4,380 ballots. According to local media, the Electoral Affairs Commission chairman pointed to issues with ballot verification papers like officials filling in the wrong box. In a vote closely watched by Beijing, out of the 1,500 seats, only 364 were contested, and just one opposition-friendly candidate won a seat on the committee. And Netflix made history at the Emmys over the weekend, picking up a total of 44 awards, the most by any company. The streaming giant outperforming HBO for the first time, with The Crown winning Best Drama and The Queen's Gambit clinching Best Limited Series. In the comedy category, Ted Lasso by Apple TV Plus took home the top prize. After 33 years, the new paper will stop its print edition and go fully digital, as part of SPH Media Trust's mission to accelerate the digital transformation of newsrooms to meet audience preferences. So, from December 10th, tmp.sg is the only place where you can find its content, its creative storytelling, as well as its sports, crime and entertainment coverage. And it'll have a new look from October 25th when it launches a revamped website. For more news and videos, visit straitstimes.com and remember to subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman. See you tomorrow for more stories on The Big Story.